Whether you've recently been diagnosed with breast cancer or are looking to correct a birth defect, there are many options for breast reconstruction surgery. And here with details is Dr. Matatov and Dr. Tarabi with Aesthetic and Restorative Breast Center. Good to see you both.
Good to see you as well.
So Dr. Matatov, tell me a little bit about the new law that was passed that's helping patients with breast reconstructive surgery.
Sure. So last year in December, a new law passed was called Breast Reconstruction Education Act, which requires Secretary of Health and Human Services to implement an education act to make the breast cancer patient aware of that their reconstructive options are available. So considering this, last year was 230,000 breast cancer patients were newly breast cancer patients that were diagnosed. Only less than half of them were actually offered reconstruction. Wow. So with this new law, it'll be more accessible to, there'll be a lot more access for them to have their reconstructive options and go see their plastic surgeon and discuss this. They don't have to do the reconstruction, but at least be aware that it exists.
Right, and let's talk a little bit about some of the options. Dr. Tarabi, you were telling me there's quite a few different options for patients.
Yes, there's always the implant-based reconstruction, which is still one of the most common ways that the breast reconstruction is done, with either implant in one stage or tissue expanders first, and then you get an implant. The other option, which gives you a more natural look, is using the patient's own tissue, and we design it to what their breasts look like previously, and try to match with their own abdominal tissue, thigh tissue, or some of their back tissue to be able to reconstruct their breasts.
And you were telling me that you're one of the few places that actually offers this, using your own tissue, right?
Yes, it's becoming more common in the United States, although in Arizona it has not picked up as well as a lot of the other parts. As I trained in New York, and it was becoming more and more common, as well as Dr. Matatov trained in New Orleans, which they did a lot of microsurgery breast reconstruction.
And Dr. Matatov, tell me a little bit about the timing of this, when people should start to look at some of their options.
Sure. Well, once the patients get diagnosed with breast cancer, it's kind of a whole team approach, and there's a lot of things that coming at them. They're going from one doctor to another. So the usual sequence is that they're seen by a breast cancer surgeon, and then seen by their oncologist, and if need to be, radiation oncologist, and then sent to a plastic surgeon to discuss if and when to do the reconstruction. Majority of the time it is preferred to do the reconstruction at the same time as the breast removal. It just gives you a better reconstructive outcome. But in certain patients, if they do have to undergo radiation or their tumors too advanced, possibility for reconstruction can be done later after things have settled down.
And what should they expect from the results long term?
Sure. Both options are good with implants as well as autologous tissue reconstruction. With implant reconstruction, what happens is that down the line, say 3 to 5 years, usually they have to have some kind of revision because implants tend to move around. With your autologous, your own tissue reconstruction, whether it's the back or the abdomen, the reconstruction is done. We do all the final touches, and that should be it. And the breast lives there, grows with the patient, gains weight, loses weight as the patient loses weight, and it's a more natural appearance to the breast.
Right, and you've got a special event coming up, too, where patients can come in and learn more about this.
Correct. We have the Breast Reconstruction Awareness Day, or BRA Day, and it's on October 19th. It's at our facility. You're more than welcome to come. We'll have some breast cancer patients that actually went through the whole process. And if there are any new patients that are diagnosed and have some questions, it'll be a great time to ask either us or the patients that experienced the whole event.
All right. Well, thank you both so much for being here today.
All right,
thank you.
For having
having
us.
And if you'd like more information on Aesthetic and Restorative Breast Center, visit them online at breastreconstructionaz.com or call the number on your screen.